Hi, welcome to Infusion Health, the podcast. I'm comedian Chris Patrick, a.k.a. Self-Proclaimed Power Man, and I'm here with my co-host and significant other, Rach.
Hey, guys.
Now, today we got an interesting show, and first of all, shout out to all the people in the healthcare industry who are helping us get through this pandemic and definitely this variance going on. And with that being said, there's a lot of people in the healthcare industry that even they're working extra hours, getting paid more, and some of them don't even want to work the extra hours. A lot of people are in the health industry, and Rach can testify to this, that it's getting bad out there on them because it's a lot of stress, and they're going through a lot of stressful things and a lot of stressful situations. But we have a guest on who's calling in from Seattle, Washington. Now he's a certified pediatrician, and he's now a physical coach, and he helps people who in the health industry. Physician's coach. Thanks, Rach. Physician's coach who helps people in the industry. In the medical industry, as far as what they're going through with this pandemic and how people are, what are they calling it, burnout?
Burnout.
That people are getting burnt out and actually leaving the positions, are not.
Well, not leaving positions, but just plain being burned out. Last year we were getting anxiety and PTSD and that kind of form, but now we're getting burnt out. So we're going to welcome in Joe.
Yeah, and Joe, and okay, his name is Joe Sherman. Sorry about that. His name is Joe Sherman. Like I said, he's calling in from Seattle. Joe, welcome to the show.
Hi, welcome. Thank you so much for having me. I appreciate it.
Yeah, so you work with physicians that have been going, and as you know, we've been for the last couple of years, we've been going through this pandemic, and like I said, people are getting burnt out and stuff like that. So what exactly do you work? You work with people like that, and
yes, I am a certified physician professional development coach. That's kind of the formal title. And I work primarily with physicians, but all kinds of healthcare providers in helping them understand where they are in their careers and how their experiences in their practices, on the job, in the hospital, in clinics has impacted the choices that they want to make in their careers and how they would like to be able to survive and actually thrive in practicing medicine, especially during this challenging time that we're in now with the pandemic.
Yeah, we're in a crazy time right now. So, what about people who want to leave the profession?
Yeah, so there's people have read about or talked about this idea of the Great Resignation, where kind of as a result of the pandemic, people have really had a chance to stop and take a look at their lives and their professions and their work. And many people have just left. And that's in every field, wherever you are. Yep. But especially in healthcare. In healthcare, we're finding that everyone in nursing is hit very, very hard. Nursing, medical assistants, therapists, respiratory therapists, physical
CNAs,
therapists, medical
NSTs.
social workers, CNAs, everybody, they're just tired of it because during this time, they have had to be not only their job, but they've also had to be the family, represent the family with all of those patients that they've been taking care of because the family wasn't allowed in the hospital. They weren't allowed in the clinic. So all of a sudden, all of these other health professionals have had to wear so many different hats to support their patients and to support the families of the patients they've been taking care of. So a lot of people in healthcare have now resigned. The deal is, though, that doctors, we are a special breed, I think. And it's not always a good thing because we have been programmed to never give up, never say no, always take care of the patient. And so no matter what the conditions are, we in our hearts believe that we can make a difference all the time. So we are still in crisis mode. And after 2 years of being in crisis mode, all of a sudden, all of those neurochemicals and hormones inside your body that are supposed to act when you're in crisis mode are getting worn out. Yeah. They're getting depleted. So all of your adrenaline and cortisol just gone. I'm sorry?
And there's an oath for the doctors, but I think even for us as medical professionals, all medical professionals take that oath, not just as the doctors, but all of us take that oath very seriously. You know,
I believe that this is really true. And I think this is, again, not only in medicine, a lot of social services also, because I kind of bridge the gap. A lot of my work as a pediatrician has been in the community clinics and shelters and in those areas of underserved populations. And there is this sense of crisis mode that if you say, hey, everybody, drop everything, we all have to go into this direction and start to help in this area. No matter what the situation is, we have been programmed to say, all right, we're a team, we do it together, let's pitch in and help out as best we can. And if you keep doing that constantly for 2 years, you get burned out.
Yeah. So, well, I really can't talk much about that profession, but I know Rach is a CNA, and from some of the stuff she's telling me, she tells me like people come in and they think that they got COVID, but actually they just got the flu or they just got something and they're demanding.
Well, it's not just that. I mean, it's people being sick in general. And it's where last year we were looked at as heroes. Now we're being blamed and yelled at by a lot of our patients. And that's hard. And a lot of healthcare professionals, at the beginning of this podcast, you said that we're leaving the profession, but a lot of us aren't trying to leave the profession as much as like change what we're doing in the field before we leave the profession.
Mm-hmm.
So
go
ahead.
This is something that is a major problem because what has occurred is that as time has gone on, this whole idea of healthcare with COVID and the pandemic has become political. We in healthcare, I think, even though we all have our political leanings one way or another, we've always looked at the science as telling us what the direction to go in should be.
Mm-hmm.
And when all of a sudden people who are non-medical are saying, no, look, this is a political issue. You're infringing upon my rights, whether it's vaccination, whether it's lockdowns, whether it's getting tested or any of these things.
Yeah.
And what's happened is, unfortunately, is that people's decisions impact directly the lives and the experiences of health professionals.
Yep.
So when you come in the hospital, your personal choice and your personal political leanings, whatever they are, impact my life and put my life at risk sometimes.
Yeah.
And so now what's happening is there are patients that are targeting health professionals as being the cause of their distress in the pandemic.
Yeah.
And so now this is putting in a whole nother layer, exactly what Rachel was talking about.
Yeah.
And this is what we're hearing reported now. People are in the hospital and they're being attacked verbally, psychologically by patients who say, you can't make me get a shot. You can't make me get tested for COVID. You can't. It's like, look, I'm just trying to take care of you.
Yeah. And it's not just about let's put it out there. It's not just about the pandemic stuff. It's about healthcare in general. They are questioning us about everything now, about cardiac stuff and about brain stuff and about everything. And it's like, we're just trying to take care of you in the best way that we know how.
Yeah.
Yes, I think that this is something that, I pride myself as a pediatrician in really trying to explain the reasons why things happen, especially to parents that are really concerned about their kids.
Scared.
They're really concerned they're scared to death if their child gets sick, has a fever. And so I really want to work with those parents. I want to be able to explain what's going on, not just say, here, take this prescription and, call me if your child doesn't get better. Yeah. I like to understand what's going on with my body.
Yep.
And And so I want to try to explain things as best I can. And so if parents or patients have consulted the internet and they've looked online and they've
Oh my
said,
goodness.
hey, look,
Yes.
I looked at this online and it says this, this, and this.
Yep.
Well, can you tell me, is that true? Is it not true? Or, what do you think about that? And I say, good for you for really being proactive in trying to find out more information. But I have to tell you, you have to be careful about where you look for that information.
Yeah.
So we may have a discussion about that.
Well, that's kind of been my thing. Don't hate me, but I'm African American, and before when I was waiting for the virus the shots to come out, what do they call it?
What are you looking for?
The immunization, the vaccine.
The vaccine. I was waiting for the vaccines to come out, but my thing was I wasn't going to be the first in line because I was like, all right, let them see how it reacts to everybody else before I go put my arm in. Now, I don't consider myself an anti-vaxxer. I haven't been vaccinated yet. I will admit it. I don't consider myself an anti-vaxxer. And I got a friend whose girlfriend's like, oh, Fauci's in with China. And I'm like, that's all a bunch of BS that they're putting on the guy and all that. And I said, well, your girlfriend's a conspiracy theorist, and there's all this stuff that I don't believe in all that. I'm not an anti-masker. If I go into a mall or something, they say, hey, you got to wear your mask. I keep my mask in my back pocket. I throw it on, no problem. But my thing is just, and Rachel's been, you got to get the shot. I'm like, I want to get the shot. I will get the shot, but I got to do some investigation. Now, me being African-American, I know that you got the Tuskegee 9 where they purposely infected them with syphilis. And I'm like, okay. Again, I'm not a conspiracy theorist. I just want to know, okay, what exactly they're shooting into me? What exactly is it? And like you said, I want to do my research before I go put my arm there and letting somebody shoot something in it. That's the only way I'm looking at it, But like I said, I'm not an anti-vaxxer and I'm not an anti-masker.
Yeah. So, I would say from your perspective and where you're coming from, I don't blame you for any of that thinking or any of those decisions you're making.
Yeah.
Because from your perspective, and any people that and people who have come before you who are African American have been burned by healthcare, have been burned by all institutions in the United States. We have a structure politically, sociologically, which has been based on racism and based on slavery for hundreds of years. So from that perspective, you have reasons to be suspicious.
Yeah.
So for you to be able to kind of like look and say, what is this that's going on here? Who can I really trust?
Yeah.
So from that perspective, I say, who do you trust in your life? Who is it that you believe that truly understands your lived experience and the lived experience of whatever cultural group that you have been a part of? Go to that person. Go to those people who you really trust and you think are going to be as honest with you and have had the same experiences or similar experiences that you have.
Mm-hmm.
Talk to those people. Don't talk to me because, I'm an old, bald, white guy, as my daughter will tell me. So if I tell you something, of course you're going to be suspicious of what I say.
Yeah.
And so from my perspective, I say, don't just take it at face value from what I say, because I think it's important to hear from people that you truly trust and ask them.
Yeah, exactly. So what do you think about, like, because I see these people, and these people are coming into PTA meetings and stuff like that, big PTA meetings with the school officials. I'm talking places like down in Florida and all that, and they're like demanding my kids shouldn't have to go to school with mask on and all this. And I'm like, what are you? And I can't believe these people. I'm like, what are you? What is wrong with you? I don't want my kid to wear a mask in school and blah, blah, blah. I'm like, and I can't believe that they're actually serious.
Well, I think this is what leads to why healthcare officials are getting to the point of burnout and frustration and all this other stuff. This is why we're like, okay, what do I do from this point?
Yeah, and I think it's important for all of us to understand that even before the pandemic hit, that health professionals, healthcare providers were suffering from burnout at a rate of around 40%, even before the pandemic hit. So there were studies that have been done, surveys amongst practicing physicians before the pandemic, when asked, do you believe, you're practicing now as a doctor, do you believe that you are burned out? Now, burnout means emotional exhaustion, that you're just kind of like done.
Yep.
Depersonalization means that I go into a room, I'm just kind of like going through the motions. I'm really not making the connection with my patient. And then the third component is a lack of feeling like you have any type of impact or benefit to what you're doing in your practice. So those three components, that's emotional exhaustion, depersonalization, this kind of separation and distancing from the patient, and then the lack of feeling like you have any type of meaning or any purpose in what you're doing. And so we already were suffering through that. Now those numbers are over 50%.
Absolutely.
Which means that when you go in now to see a doctor, go into the hospital, go to the clinic, go into your office, whatever, there's a 50% chance that that provider that you're seeing is burned out and is feeling those things right in that moment.
Yep.
So with burnout, she comes home and she's pretty mad, pretty upset, and
that I haven't done enough.
Yeah, but also too, there's a chance too she could take like a desk job, but she's like, well, if I take a desk job, I'm there for a year or however long before I go back, because she actually likes working with the patients and all that. And I'm like, well, maybe you should take that year and do a desk job for a year, and then you can go back to it a year from now. But at least that'll get you, But she doesn't want to do that. So what do you suggest as far as that goes?
Yeah. So one thing I think is to understand. The number one thing I think is to admit it and understand and realize that you're burned out. Okay. So to be able to admit it to yourself that, this is, maybe not I'm done, I'm ready to walk away, but I can't continue in this way any longer, or I'm just it's going to have serious physical and emotional impact on my life. So that's number one. Number two is to be able to admit that I'm not alone, that there are over 50% of other people that are in my profession that feel the same way. But we have this sense that you never let other people see your weakness.
No.
You never let people know that you're really suffering. You never really let people know that you, can't live up to the expectations. So that the other step is to admit it, is to actually, and if you don't want to admit it yourself, you go and reach out to people around you. And what I would say is you walk up to somebody that you're working with and you go, something, I just have to tell you, Rach, this is really hard for me. This has really been difficult for me. How's it been for you? Mm-hmm. And that provides an open door to the person that you're working with to admit to themselves and to you that they are actually struggling also. This is not something that we were role modeled in our training or in our profession at all. Mm-hmm. So it's countercultural to kind of like medical culture. But for us to be able to admit it to ourselves, admit it to our colleagues who we are working alongside of, is a great first step. The next thing is to be able to create some personal boundaries. We have to be able to separate ourselves and our identities from the job that we are doing. So when I became a pediatrician, I was like this young, idealistic kid. I said, I'm ready to work 24 hours a day as a pediatrician. I'm going to go out there. I'm going to save children. I'm going to do all this. Right. And that's wonderful. That's a great, I guess, aspiration. But it's impossible. It's inhuman. You can't do it. We're all humans.
It takes emotional toll on yourself because, you're inhumane if you take case after case after case after case, not take an emotional toll on yourself.
Exactly. It's emotional and physical. So you have to be able to say, all right, work is work and home is home. And I have to be able to walk away. I have to be able to walk away physically and emotionally. I have to be able to say, I've done my best for the day. Whatever didn't get done, didn't get done. And now I need to leave. I need to go home. I need to make that transition somehow. Maybe it's change clothes. Maybe it's listen to music. Maybe it's meditate. Maybe it's do something to kind of symbolize that I am taking off my medical uniform here. And now I'm a dad, a spouse, a friend, a normal human. Now I'm going to just watch TV, read a book, listen to some music, do something completely different where you shut off.
Well, with that said, the pandemic kind of hit us all kind of way out of left field. What are some changes after this that you think should be made in the medical profession to help with this going forward with the medical profession?
That is an excellent question, and I think this is something that we all have to pay attention to, because the inertia will be, thank God it's over, let's get back to so-called good old days. Good old days weren't good. Mm-hmm. So we realized that from a lot of things during the pandemic, including structural racism, misogyny, there's all kinds of other things wrong with our society. The good old days weren't good old days.
Mm-hmm.
So we don't want to just fall back because we're so glad it's over. We want to really look critically and see what's going on. Number one is, because medicine has advanced so much technologically and has become so complex, it probably, from my perspective, isn't reasonable for a doctor, nurse practitioner, physician assistant, or whatever to be seeing and attending patients 5 days a week, all day long. That's, for me, I don't think that that's possible anymore.
Well,
some people
I've
may
heard
kind of blow
the
that
term patient amnesia. Where, and I can't say that it's, the term is so true these days, patient amnesia. I'm literally looking at my brain sheet and saying, okay, when I go to report to my next shift person, I need to write on my piece of paper what I did with each patient, the most important, prevalent thing to tell the next person, because I'm not going to remember after my 12-hour shift everything that was most prevalent because of patient amnesia. And,
yes.
And physicians, I can't even imagine how many patients they see throughout the day, Not
only seeing those patients, it's the number of patients that you have to see in short periods of time. And I can be honest, I finished all of my medical training in the 80s, 1980s. And the reality is the amount of medical knowledge that there was in the world was a tiny percentage of what there is now.
Yeah.
So the complexity of what I saw every day as a doctor wasn't near to the extent that it is now.
Mm-hmm.
So I don't think that it's possible to hold all of that, of the psychological and the behavioral health issues, as well as the complexity for somebody to be able to do that through the course of the day. So I think that we need to have the norm of the number of hours of clinical care decreased.
Okay.
And I think that this is what each institution really needs to take a look at, and each individual needs to take a look at.
Mm-hmm.
Part-time patient care, I believe in the future, will become more of the norm.
Okay.
What is considered to be part-time now will be considered to be full-time in the future.
All right.
Mm-hmm.
Will there be will there be more Charlie breaks? I know that was a term.
What's a Charlie break?
So a Charlie break is when you've had your limit, you just take a 10-second, 10-minute break away from everything that you're doing just to regather yourself. To have your little breather.
this is something fantastic. Let me ask you, is this something that you came up with or something that your institution came up with, or where did that come from?
From the very first nursing home that I ever worked at. They told me Charlie break. So
this is something that I believe that in the nursing profession, that people who are in the nursing profession and medical assistants, CNAs, nurses, all these different, they have recognized this a lot earlier than physicians have.
mm-hmm.
And they've recognized the need for this emotional break, this physical break, much, much earlier than physicians have. Mm-hmm. Physician culture is such that if you need a break, then you're weak in some way. Mm-hmm. So you're not matching up to, what we see as being what physicians are supposed to be able to do. So I believe that is something that if that can become institutionalized so that you do have these Charlie breaks, I love that idea to say that, listen, we know that you're going to be seeing patients throughout the day, and we have you assigned to see these appointment slots every, sometimes it's every 15, 20 minutes or whatever, mm-hmm. which I also think is impossible because you have an electronic health record in this computer where everything is in that box in front of you that used to be distributed out amongst other people in your office, a nurse, a receptionist, someone that was a medical assistant, a social worker. Now everything just comes into that computer, and now you as the provider are responsible to take care of all of it. So there's no way that you can do that and still be fully present to your patients through the course of the day, inpatient or outpatient. So if an institution can say, in your schedule, we have built in these, 20 to 30 minute openings where we want you to be able to catch up on your charting, catch up on your phone calls, catch up on these things. So we are going to automatically have every 2 hours, we're going to automatically put in 20 minutes mm-hmm. where you're not assigned anything, or 30 minutes where you're not assigned anything. Mm-hmm. Or for every 4 hours you work, we're going to make sure that you have 1 hour where you're not assigned any patient care duties mm-hmm. so that you can catch up and do with all the work that comes as a result of you attending those patients. Mm-hmm. So those are things that I think institutionally that we can do and do it more frequently.
Sure.
Mm-hmm. The other thing that we can do is to admit to ourselves and have institutional structures that allow us as healthcare providers to actually debrief and process the emotional impact of what we're encountering every day on our jobs. So what does this mean? This means that there is a gathering of your team, whatever it might be. It may be a clinic team, it may be a floor team, it may be inpatient, outpatient, whatever that is. And we're going to have a period of time where somebody says, okay, this is one of the patients that we took care of. I was involved in the care of this patient. Rachel was involved in the care of this patient. We all took care of this patient. This is the medical stuff, but we're not going to dwell on that. What we're going to dwell on is how challenging it was for me to deliver this bad news to the family mm-hmm. and how that impacted me. Mm-hmm. And what can I do to support Rachel when she has to do this, has to do that?
Sure.
And so it's a way for people to connect as a team and to feel like they have each other's back.
Mm-hmm. Mm-hmm. Well, this has been an very interesting conversation. Like I said before, we do definitely want to give a shout out to all the healthcare workers out there. We know you're working hard out there in the field. And what do you see any changes going on right now as far as our implementations going on right now to make things better? Or is it is it going to be another couple year slow process before these changes actually are made?
Excuse me. Sorry. Well, I think one of the things, excuse me, sorry.
It's all right.
One one of the things that I think we can do, and some of these changes are being done, is that some institutions and some organizations are seeing if we want to hold on to our talent, hold on to our providers, hold on to those physicians who we value so greatly, we're going to have to do something to prevent them from walking out the door.
Yeah.
So I do think that there are some enlightened institutions that are starting to implement some of those changes. And I believe right now we're entering into a very dangerous period during the pandemic where we're starting to see more than ever the mental health impact of all of that stress being there for 2 years.
Yeah.
And this is a very typical thing in disaster responses, that after the adrenaline and the cortisol are flowing and we're all there trying to do whatever we can, as we start to kind of get back to what is considered to be our normal lives, all of a sudden we now deal with all the mental health implications.
Yeah.
So right now we're seeing record numbers of people that are depressed, anxious, seeking mental health support.
Committing suicide.
Unfortunately, suicide is something that is on the increase, and you're seeing it across the board and also in healthcare, health professionals.
Okay.
Would it be possible for people, managers, to start reaching out to their workers and having one-on-one with each of them and just checking in on them and seeing how they're doing? Would that help with the burnout and checking on their mental health and just seeing what HR has available for them?
This is something that's really interesting when you look at physicians, doctors, as opposed to other staff members. If you have an institution, organization that employs CNAs, medical assistants, nurses, people who are front desk staff.
Sure.
They relate much more to a human resource office or an employee assistance program.
Okay.
Much more than physicians do. Physicians rarely make access those types of services. So there needs to be this sense of whoever is in a position of leadership within the organization to personally reach out, exactly what you say, Rachel, personally come right to the front lines, reach out and say, I know this has been challenging for you. I know this has been difficult for all of us. And I want to know if there's anything that we can do to support you during this time.
Yeah.
Just that sense that you are being valued and that someone is concerned about you is something that goes a long way. The second thing that goes a long way is a sense that there's a common mission and that people are working together for that common mission. So a lot of healthcare providers now feel like they are working for the man. They're doing what the man wants them to do, not what they feel called to do as part of their profession, their vocation. But if they feel that their mission is in alignment with the mission of their organization and they feel valued and appreciated, that will help them sustain themselves through this time.
Well, Dr. Sherman, thank you so much for doing this. This has been very, very helpful and very, very insightful. And like we said before, we want to give a shout out to all the people out in the healthcare profession. And we want to know that if you are ever in urgent care or you are dealing with healthcare professionals, be nice to them. They're working really hard. And some of them, like we're talking about, is burned out. So, Dr. Sherman, is there any way that somebody can get a hold of you? I got you at Joe at joesherman.com.
It's Joe at joeshermanmd.com.
So if you want to,
right,
if they can email you there,
yes, and I have a website, joeshermanmd.com, and I have individual coaching services for physicians to support them and help them with career discernment and how to battle burnout if that's an issue for them,
and do you
as well as retreats and workshops.
And do you do Zoom calls or anything like that?
Exactly. I do all of my work right now is done on Zoom, but we do have in the future, we do have live retreats for physicians to get away and to do some reflection on their own careers and how they can impact and influence the institutions they work for.
Okay. So if you want to reach out, and if you are in the healthcare profession and you do want to reach out to Dr. Sherman, like I said, Joe at joeshermanmd.com. And what's the website again?
It's joeshermanmd.com.
joeshermanmd.com if you want to reach out to him, or if you want to open up the gates of talking and helping you in the healthcare profession. If you feel burnt out, here's somebody to reach out to. We thank you so much. And like I said before, we definitely want to thank all the people out there in the healthcare profession. We know you're working hard, and we thank you so much. And we thank you for your service and for your dedication to helping us get through this pandemic. Dr. Sherman, thanks a lot for being on the show. And it was a great conversation.
Thank you so much for having me. I really appreciate it.
Yep. And I'll let Rach close us out.
All right, you guys. Once again, we're closing out. Joe, thank you again. And on here, history is born on lines of hate. On here, we're trying to build lines of love and teach you guys how to be your best advocate. Until next time, have a great one.